The year was 1987, and Dr. Francine Shapiro was out for a walk in a park. As she walked along the path of the park, she found her eyes flitting from the left side to the right side of the path as she noticed the rocks on either side of the path. As her eyes moved from left to right, she noticed that the distressing emotion she was having associated with a memory started to reduce. It was then that she made a hypothesis that there is a connection between rapid eye movement and a desensitizing effect on memories. This groundbreaking discovery has been the source of hope and healing for millions of people who suffer from the symptoms of PTSD. The Center for Disease Control and Prevention defines post-traumatic stress disorder as an intense, uncontrollable emotional and physical reaction to the reminder of a traumatic event or a distressing memory. And more people than you probably realize suffer from PTSD. The Center for Advancing Health reports the following statistical information about PTSD. 3 out of every 50 people are diagnosed with post-traumatic stress disorder. That number rises in accordance with the frequency and severity of the trauma experienced. 23% of veterans are diagnosed with post-traumatic stress disorder. 30% of first responders are diagnosed with post-traumatic stress disorder. And 96% of sexual violence victims suffer from PTSD. As shocking as these statistics are, they become all the more meaningful when it's someone you love who is suffering from the symptoms of post-traumatic stress disorder. In our case, those victims were our sons. We adopted 3 boys from foster care, all of who had significant early childhood trauma, abuse at the hands of their biological parents. When they moved into our house, we saw those symptoms of PTSD play out in our home. We saw disassociation, we saw irritability, we saw aggression, we saw reckless behaviors, hypervigilance, we saw reoccurring nightmares and flashbacks. But we, like millions of others, found hope and healing in EMDR therapy. Today, I'm going to explain why EMDR therapy is an effective form of psychotherapy in the treatment of patients with PTSD. First, I will introduce EMDR therapy and explain how it became a proven therapy for trauma patients. Second, I will explain the steps for treatment, including the use of rapid eye movement for desensitization and block trauma in the brain. And third, I will present statistical and testimonial evidence of its effectiveness. According to the research article by the Cleveland Clinic titled EMDR Therapy, What is it? Procedure and Evidence, EMDR therapy has been around since the 1980s and is recognized by the World Health Organization as an effective treatment for PTSD. It was first utilized to treat combat veterans, those who had experienced the horrors of war, and as a result, were diagnosed with PTSD. But it was later found to be an effective treatment for other forms of trauma as well. There are many reasons why EMDR therapy has proven to be a very effective treatment for treating trauma and PTSD. But one of the main reasons is the fact that EMDR therapy doesn't require a patient to talk about the trauma they experienced. This is huge because when patients who have experienced a traumatic event have to then talk about that traumatic event, it can cause additional trauma to that patient. EMDR therapy has proven effective for treating trauma, but how does it work? Well, EMDR therapy uses rapid eye movement to help patients process memories that are stuck in the brain so that they can find healing. According to the Cleveland Clinic, EMDR therapy uses a series of steps to help clients with traumatic memories find healing from the distressing emotional and psychological effects of unresolved trauma. The American Psychological Association describes the 8-step process in their published article, Eye Movement, Desensitization, and Reprocessing Therapy. It all begins when the treating therapist starts by gathering a patient's history, and with the client's help, it identifies memories or current triggers that they want to focus on with EMDR therapy. The therapist will then prepare the client for what to expect, including possible side effects of EMDR therapy. This step is then followed by the assessment step. This is when the identified memory is pulled up and targeted in the patient's brain, and the patient is asked to assess 4 memory components associated with that memory. Image, what do they see in their head when they pull up that memory? Cognition, what thoughts come to mind? Affect, what emotional response do they have when they think of that memory? And then body sensation, what do they feel in their body? Where do they feel it? And then rate the distress level of each component. After these preparation steps, then comes the step that most people think about when they think of EMDR therapy, and that is the desensitization and reprocessing step of treatment. During this phase, the client focuses on the identified memory while engaging in bilateral stimulation of the brain. According to the Cleveland Clinic, this step of EMDR therapy relies on the Adaptive Information Processing Model, or AIP, which is a theory about how your brain stores memories. The AIP model theorizes that during a non-traumatic event, your brain will store memories correctly. But when you experience trauma, your brain stores those memories in a way that doesn't allow for processing or healing to occur. This is where the desensitization and reprocessing step of EMDR come in. According to the National Library of Medicine, the goal of this step is bilateral movement within the brain, or movement between the left and right hemispheres of the brain. This movement between the left and right hemisphere is what helps get traumatic memories unstuck so that healing can occur. This can occur a couple different ways. The most common one is rapid eye movement, in which the treating therapist will use their finger or some other object for the patient to focus on as they move it from left to right. And as the eyes follow that movement left to right, it stimulates both sides of the brain. It can also be accomplished through physical stimulation, like tapping, alternating knees or shoulders of the patient while that memory is pulled up, or auditorily with the use of tones in either ear. This step of treatment is then followed by the installation step of treatment, which strengthens the preferred positive cognitions, a body scan in which clients are asked to observe the physical sensations and the changes in their body as they go through the process, and then closure and stabilization. This is a very important step in treatment because this is used to then recontain that memory before the client goes home so that they can remain safe and stable and less affected by the work that they've done until their next treatment with the therapist. Most EMDR therapy sessions last about 60 minutes, and the average person takes 6 to 12 sessions to fully process and heal from a memory so that there's a reduction in those PTSD symptoms. Usually, the more severe the trauma, the more sessions are required. This process, like many forms of trauma therapy, aren't always easy, but EMDR therapy is an evidence-based therapeutic approach that has proven its effectiveness in the lives of millions of patients. The EMDR International Association shared the following patient testimonial from a Vietnam War veteran seeking help for long-standing combat trauma. This gentleman had tried many traditional forms of therapy and had found no relief. So he sought out EMDR therapy with a certified EMDR therapist. And this is what his therapist shared. After about 3 repetitions of bilateral stimulation, he started telling me that the picture was no longer as intense as it had been. And after the 5th set, he lost the picture entirely. And he said to me, "You know, it's too bad that my friend died because he was a good man." The therapist then concluded, in that 20 minutes, we saw combat trauma that occurred nearly 30 years ago resolved in a matter of 20 minutes. This testimonial does not stand alone. According to the EMDR International Association, EMDR therapy has been used in over 130 countries to treat more than 1 million patients successfully. So, in conclusion, eye movement desensitization and reprocessing, otherwise known as EMDR therapy, is an effective form of psychotherapy used to treat patients with PTSD. It has been around since the 1980s and is recognized by the World Health Organization as an effective treatment for PTSD. It uses rapid eye movement to help patients process memories that are stuck in the brain so that they can find healing. And EMDR therapy is an evidence-based approach that's proven its effectiveness in the lives of millions of people. I have seen it in the lives of my own children. My sons are numbered among the millions who have found hope and healing from the life-debilitating symptoms of PTSD.